Welcome back to Studious students. In this video, we'll talk about azithromycin. Now let's understand the mechanism of action. Azithromycin is an antibiotic. Yeah, this is an antibiotic punching a bacteria. It belongs to a group called macrolides. What's the job of a macrolide? It's to stop bacteria from making proteins. But why are proteins important? Because they are the building blocks of life. They build cell parts, they repair damage, they produce energy, and they help bacteria in moving and multiplying. This slide shows the basic structure of a bacterium. The outer layers help protect the bacteria, while the flagellum helps in movement. Inside the bacterium are ribosomes, which are responsible for making proteins. There's also the nucleoid region that contains the bacteria's genetic material. Azithromycin mainly targets the ribosomes and stops them from producing proteins. Without protein production, the bacteria cannot grow and survive properly. Azithromycin first enters the bacteria cell. After entering, it travels inside the bacteria and reaches the ribosomes. This is the beginning of its action against the bacteria. Once inside, it starts interfering with protein production, which weakens the bacteria and prevents further growth. Inside the bacterial ribosome, there are two parts, the 30S subunit and the 50S subunit, together forming the 70S ribosome. Azithromycin binds to the 50S subunit. The mRNA carries instruction for protein production, but when azithromycin attaches to the ribosome, the process gets blocked. As a result, the bacteria cannot make proteins properly, which stops its growth and multiplication. Now, coming to the uses, azithromycin is commonly used for chlamydial infections and is considered the first choice drug in many cases. It is used in conditions such as urethritis, which is inflammation of the urethra. It is also used in lymphogranuloma venereum, a sexually transmitted infection caused by chlamydia. Another use is chlamydial pneumonia, where it helps treat respiratory infection caused by the organism. Azithromycin is used in the treatment of Leishmania's pneumonia, a severe lung infection caused by the Leishmania bacteria. The bacteria invades the lungs and cause respiratory illness, fever, and breathing difficulty. Azithromycin enters the infective cells and stops the bacteria from making proteins. This prevents the organism from surviving and spreading further into the lungs. Mycoplasma pneumonia is another important respiratory infection treated with this drug. The organism commonly causes atypical or walking pneumonia. Pertussis or whooping cough causes severe uncontrollable coughing spells. This drug helps control the bacterial infection and reduces transmission to others. Typhoid causes symptoms such as diarrhea and abdominal cramps. This drug helps eliminate the Salmonella bacteria responsible for the infection. Chancroid is a sexually transmitted bacterial infection that causes painful genital ulcers. This drug helps treat the infection and prevents further bacterial spread. Streptococcal infections can affect multiple parts of the body. Tonsillitis and pharyngitis cause throat pain and inflammation, while otitis media affects the ear. Cellulitis is a skin and soft tissue infection, and pneumonia affects the lungs. This drug helps control the streptococcal bacteria responsible for these infections. Prophylactic uses means preventing disease before it occurs. This drug can be given to prevent bacterial endocarditis in high-risk patients. It is also used in the prevention of recurrent rheumatic fever. MAC infections are caused by the Mycobacterium avian complex, especially in patients with AIDS and weakened immunity. These drugs help prevent and control these opportunistic infections. Toxoplasmosis is an infection caused by the parasite Toxoplasma gondii, commonly associated with cats. The drug is used as a part of the treatment, especially in patients with weakened immunity. The most common adverse effects are GIT disturbances. Patients may experience nausea, vomiting, abdominal cramps, and diarrhea during the treatment. Allergic reactions may occur in some patients. Common symptoms include skin rashes and fever. Hepatotoxicity refers to liver damage caused by the drug. The adverse effect is rare but can occur in some patients during the treatment. Cardiac effects are rare but important adverse reactions. The drug may prolong the QT interval on ECG, which can increase the risk of arrhythmias in some patients. Ototoxicity refers to damage affecting the ear and hearing. Hearing impairment may occur at high doses or during prolonged use of the drug. Superinfection occurs when resistant organisms or fungi grow during the antibiotic treatment. This happens because the normal protective bacteria of the body may get disturbed. Local irritation may occur during IV use of the drug. Patients can experience pain or discomfort at the injection site. Thank you everyone for watching. I hope this video helped you understand the mechanism, uses, and adverse effects of azithromycin in a simple and memorable way. Every diagram in this presentation was hand traced and designed to make learning faster and high yield. Recording, scripting, editing, and creating these visuals take many hours of work. If you find this helpful, please like the video and subscribe to support the channel. Your support motivates me to create even more high yield MBBS content like this. Thank you.